Hi, everyone. Welcome back to Black Menace, Survival Steps to Beat COVID-19 in the African American Community. I have a special guest with me today in the studio is Dr. Dori Russ, MD, Esquire. She is a community servant with a passion for educating and inspiring the public. She is a graduate of the University of South Florida, University, Florida, Levin College of Law, and Meharry Medical College. She completed her family medicine residency at Mayo Clinic, Florida. She is currently pursuing a Master's of Public Health degree at the Columbia University Mailman School of Public Health. With a commitment to the underserved, she started her career as the Associate Director of Primary Care Services at a federally qualified health center. She then became the Medical Director of the Russ Group, LLC, a boutique consulting and clinical services organization, and she continues to contribute to the legal community by participating in pro bono clinics, including wills, duration of civil rights, and sealing and expungement. And she was simultaneously recognized as one of the top 40 under 40 best advocates by the National Bar Association and one of the top 40 healthcare professionals under 40 by the National Medical Association. So welcome, Dr. Russ. How are you today?
I'm well. Thank you so much for having me.
Thank you so much for agreeing to be a part of the series.
Absolutely. It's such an important message to make sure we get out, especially to our community.
Yeah. So when you and I were earlier, you had me thinking about several things. And one of the things is making certain that we have our affairs in order. And many people don't think about those things. They're going through COVID. Some have it, some don't. Some have lost loved ones, and some don't even have life insurance, and just so many different parts of this. So can you educate us, please, about how to get our affairs in order?
Absolutely. So when you want to think about pre-COVID, everybody, basically, you wanted to have advanced directives, which let people know, if I go to the hospital, these are the measures I want. The benefit of having that is if you are in a critical state, you take that pressure off of your family of having to decide what to do for you, to keep life-saving measures, to stop life-saving measures. And then you also want to make sure you have your financial affairs in order. So everybody at a minimum should have a burial policy, right? Like you have to be able to make sure that you can, as we like to say, be put away nice.
Yes.
But beyond that, if you're able to, you want to be able to provide for your family. You want to leave a legacy. So then that gets into life insurance, and you have birth, term, and whole life insurance, which I'll let the financial experts go into the pros and cons of both. But if that's not an option, and I understand that we're not a monolith, we all come from a different financial background, what you do need to do is have a will. And when we typically think about wills, it's who you want your house to go to, it's who you want this piece of property to go to, but also it can deal with what you want to happen to your kids. If something should happen, if you and your partner were to both die, and with COVID, we've seen that. We've seen families and generations dying within days of each other. You want to make sure you had those provisions. I've actually recently updated mine because if something happens to my husband and to myself, where would our son go? So you want to make sure you have that. And when we talk about the generations, well, if I thought my mom was going to take care of him, but now she's in a high risk population, what's my backup plan? Because the last thing you want is a generation of kids dealing with the grief of COVID and ending up in the system. So those are the things. Sorry?
Oh, that's fine. That's so. I was just thinking about that because we already have a lot of children in the system.
Absolutely.
Yes. And so having your own children go into the system, which is not something that you would even have thought of, that's traumatic.
It is. And you have to think about it. It's not a comfortable thought. Nobody wants to think about not seeing their child grow up. But we don't live, where we live now is different than it was 3 months ago. We live in a different world. And as we start to accept that, then we'll be able to make those proper preventative measures to deal with it.
What do you say to those people who mindset is, I'm not going to get my affairs in order, and when I die, I just die because I don't want to leave nothing to nobody?
If you don't set up who it's going to go to, the state will step in. It's called dying intestate, and they actually will. There's a level of who gets your stuff. So you can decide who gets your stuff, or your respective state can. I personally, even though I won't be here, I want some kind of say in it, Now, y'all might do whatever y'all want to do after I'm not here, but I will at least have felt like I was heard. So again, even if you don't, someone will step in and make that decision. And then sometimes that's where the attorneys come in when things end up in probate. So it actually goes to court. And a lot of times people will end up spending all the money on the attorneys in court when you could have had the property and the money. So it's a personal decision, but if you want to leave a legacy, if you want to give something to those that you're leaving behind, because face it, we're all going to go that way one day. I want to have a say. I don't know about you, but I want to have a say.
I want to have a say. I got my affairs in order because I know many people who have died and it went to the state. And I thought, why would you do that? Because the state is going to do what the state wants to do. And if the state didn't really care about you, you know, your kind, why would you want to leave them some free money?
I'm right there with you.
You know, so that's why I was asking you that question, because this has come up this week talking with several people that I know. And I've said, really, why would they want to do that? And some of the remarks I was told was, well, they said they people didn't do nothing for them and they don't want to leave nothing to them. And I thought, wow, they really need to rethink that.
Well, I hope that that's not the case, but if anybody feels that way, find a cause that you're passionate about, a school, something. You can leave it to a variety of different organizations if you don't have a particular person in mind. So there are options.
Yes, there are a lot of wonderful charitable organizations out there, different causes, as you mentioned, where that is a need for that. Okay, thank you for covering that.
Ooh, that's deep.
Very deep. Now, you and I talked a few minutes ago about the NAACP hospice state planning. What is that about?
So the Jacksonville NAACP will be hosting a town hall on hospice and estate planning. Hospice is a wonderful service when someone does have a terminal condition and a certain amount of time left to live, that provides services for the patient, but also the family. We all know if we've cared for a loved one who is going through that process, caregiver stress is very real. So it provides chaplain services, it provides nursing and social work services, as well as medical services. So it's a comprehensive care model. And a lot of times people that look like you and me don't take advantage of it because they don't know about it. So again, once you've accepted that one day we all will die, hopefully it will be peacefully. The next step is to make sure you're having a good death, that you're dying in a way that is comfortable as possible, and that you're taking care of your family too. My husband's actually a pastor and a chaplain for a hospice organization. And even after that process, they follow up during the bereavement process so that you don't feel as alone. I mean, grief is hard. And when we talk about grief and COVID, that's a whole different thing, because the way we grieve, we can't even grieve that way. You're limiting funerals to 10 people or drive-through funerals or all kinds of manners. And we're a very social people. We grieve loudly, we grieve openly. And I can't even psychologically process what not being able to do that has done. But again, with the hospice model, it lets you have someone to grieve with going forward into the future. They do calls, they check in, because that's their specialty. That is what they know, how to guide people through the dying process and how to guide survivors through the grieving process. And then the estate planning piece is what we talked about earlier. What are the different steps you need? And especially with advanced directives, like, yes, I definitely want you to have your will, but I also want you to know, like, I can have a say in what happens. I'm from Florida. So again, in 2005, we had the Terry Schiavo case, which was a case of a woman whose husband wanted to take her off life support. The parents didn't want to. And again, the best way to have your voice heard is to let people know. And it's hard. Nobody wants to think about it. I completely understand that. But once you know that, okay, if I tell someone, they don't have to make that decision. They don't have to feel guilty. I have patients all the time that are like, I had to take my dad off. Like, that stays with people. But if you know you're honoring somebody by saying, well, this is what he wanted, so I'm honoring his last request, it makes it a little bit easier.
That's true. And when you mention hospice, so that's for when when they estimate 6 months or less to live. Would that be correct?
Yes, ma'am.
Okay. And as far as the advanced directive, I've heard a lot about that. So some people have said that due to COVID, that, I don't know if this is true or not, because I'm not an expert in that, but I have heard so many things about some people not being resuscitated, and it's not due to their choice. It's just not being done. So with the advance directive, let's say if you're someone that had a heart attack and you shared with your family members, okay, I don't want to be in a vegetative state. No matter what happens to me, I don't want to be in a vegetative state. So if the choice comes to that, then follow my wishes. So how would that work in an advance directive if you're someone with a chronic illness and you're expected to be terminal, or let's say surgery is a failure and you wake up, or you may not wake up and you're in a coma?
So let's talk about pre-COVID and let's talk about the world we find ourselves in now, because they're very different realities. So pre-COVID, the expectation would be that that wish should be honored. So we talk about advanced directives, and that would be DNR, or do not resuscitate, which would be no life-saving, no heroic measures. And then we have, well, I want this measure, but not that measure. And it's actually a checklist that you can go down. So pre-COVID, the expectation would be if you had that paperwork and your family was aware of those wishes, that would be the route that was taken. Again, it can be interesting, especially in a family where there might be multiple siblings and this person wants this and this person wants that. Well, mama told me this and mama told me the opposite. Having that clarity can provide relief for both the hospital staff who wants to make sure they get it right. There are a lot of things you can mess up on. Advanced directives aren't. And then also the family, and having an appointed spokesperson that the patient actually chose. Because sometimes some people want to step up to be like, no, I'm the one who's going to be the decider, as one of our presidents famously or infamously said. So that's how that works. So it should be honored. In a pre-COVID world, that would be the expectation. Now, fast forward 2020, which has been a year that no one saw coming and has taken us all off guard, we run into the situation, well, what if I want everything done, but there's simply not enough machines to do it? So that was the concern with flattening the curve, what we ran into in Italy, what New York was starting to face. What happens when you don't have enough ventilators? Who makes the decision at that point? And so then it becomes a matter of allocation of resources. Do we have it? Is there a set protocol? What I always tell people is, think about who's making that protocol. How did they treat you or your community before that protocol was made? And those are things that can guide you. So the expectation would be that it would be honored, but during extreme times, so a pandemic it's an unprecedented event, there might be a different formula. So similarly, if there is a big catastrophic event, sometimes you don't do normal medicine. I tell people to think about it as wartime medicine. Sometimes you're trying to triage and save as many people as you can. And again, each human life is important. There's no doubt about that. But sometimes in trying to save more, you end up unfortunately having to let some people go, which I think that has been the biggest change as a healthcare provider for me to reconcile. I think in war, we inherently think, okay, some people aren't going to make it. I think if there is a massive casualty, a bombing, a terrorist event, okay, we're going to get in and we're going to save as many people as we can. I think when we think of a virus and not being able to save people, I think that's what's heartbreaking. And it's really challenged and changed so many perceptions. And that was what the message was behind flattening the curve, which, again, depending on what data you hear and how accurate the data is and who's reporting the data, it seemed like New York was the only place to have a surge. But by my last reading, Montgomery, Alabama is actually now at capacity too. And so my fear always was, once it hits the South and rural areas, we're all in a lot of trouble.
Yes, definitely in a lot of trouble. So I'm in the state of Illinois, and I looked at some of the coronavirus data from the local health department. And so just in my county alone, which is Lake County, as of yesterday, there was 7,168 confirmed cases in our county, 234 deaths. Tests performed was 33,212. And long-term care, 1,155. But deaths in long-term care, 154. Now, statewide, the entire state of Illinois, 102,686 statewide confirmed cases of COVID, statewide deaths, 4,607. and statewide tests performed is 617,159. So as this continues to spread, we are beyond in trouble. And when you mention rural communities, definitely is going to hit a lot of people, because in rural communities, many of them are so far spread out. There's not enough rural doctors to go around to patients. If they even wanted to do telehealth, there's not broadband in some of these communities. So there's definitely a lot of challenges. And many of them are far to travel if they want to see a doctor. And now you can't really go in to see the doctor.
Right. So I am an outpatient physician, and we have transitioned into a telemedicine, and so 2 weeks telemedicine, 1 week in the clinic. So it has been a challenge, because you run the risk of someone being sick and coming into the clinic and spreading it to staff and other patients. And then you also run the risk of people really needing to be evaluated for some things that there's some things you can treat over telemedicine. And there's some things that you need to evaluate in person. So that's why we have the split model, but it is a challenge. And when you talk about broadband, it's not just broadband. It's, does someone have a phone with video capability? Does someone have a phone? That's when we get back into these social determinants of health, those things that the doctor can't fix. It's a systemic issue that has to be addressed, whether it be food deserts or health literacy or access to technology. COVID-19 has definitely taken the lid off of that. If it was hidden, it was never hidden to me. I always saw it. But if it was hidden to other populations, they've now seen it too.
Yes. Now you're an outpatient site. So outpatient, do you all have a large Medicare population?
I think we're at about 1/3 Medicare. Again, I'm in Florida, so Medicare tends to skew a little bit differently in Florida.
I was only asking because of, I know some practices are starting to utilize CCM, chronic care management, and that's, for patients with at least one or two or more, comorbidities.
Absolutely.
Okay. Now, based upon everything you had just said, this is really a huge eye opener, because in the media, I haven't heard them talk much about Black health, how COVID is affecting us. Is why I created this digital series. And number two, getting your affairs in order. Many are not talking about that. Now, what about with our African-American women? We got families where children are in daycare. They don't have the luxury of staying home with their children because they're on the front line, whether it's medical, whether it's a caregiver, whether it is low-wage jobs where they can't do it at home. Where do they go?
So I do not have a good answer. There is no good answer. We found ourselves in a perfect storm. So if someone does have to send their child to daycare, the best thing you can do is to be in communication with that daycare provider, to know what their protocols are, to make sure that the children are having their temperature checked, to make sure staff is having their temperature checked, to make sure there is frequent cleansing. I mean, we have the kids kindergarten through 12th grade, they didn't go back to school, but with kindergartners, again, that's not I'm sorry, with preschool and younger, that's not an option. They have to be somewhere if mom and dad have to work. So again, it's a matter of communication. It's a matter of being open and transparent. If your child is sick, please, please, please. I know it's a huge sacrifice, but that day you have to keep them home. And most preschools are really good about that. Even before COVID, if there was a fever, they had to be fever free for 24 hours before they could go back. Because again, initially when this started, we thought that children weren't affected. And now 3 months later, we know that there's a whole syndrome that's unique to children. And as a mom, it's terrifying. Nobody wants to think about losing anybody, but I promise you nobody wants to think about losing their child.
No. And with these daycare facilities, there's, many different kinds. So what came to my mind was you've got these standalone facilities, KinderCare. I mean, just using some of the names I've seen, but what about those daycare facilities that are home-based, that somebody in the neighborhood has said, set up shop where they're going to watch your children? My concern about that is, what precautions should they be taking? Because it's not like a larger facility that may have a lot of money to invest in certain things to keep the kids safe. But let's say you're someone that you're operating out of your own home and you may be taking care of 6 to 7 kids. So I'm just thinking in terms of sanitation, wiping things down. Some of them may not even know what to do.
Right. So again, you want to start with the basics. Right now, the CDC is recommending anyone older than 2 should be wearing a mask. And I do want to say something about masks so that we're all on the same page. When you wear a cloth mask, that's to protect others from you. The cloth mask prevents your germs from spreading to them. So I think a lot of people think as long as I'm wearing my mask, I'm protected, and it works the opposite way. So I did want to take a moment to say wearing the mask protects others from you. Frequent hand washing. And it's hard. I'm a grown woman and probably touch my face at least once or twice an hour out of habit. So trying to get a 2-year-old or a 3-year-old not to touch their face, I can't even fathom that. But we have to work on it. So behavior modification, not touching your face. And little kids love to love on you. They love to love on each other. They like hugs. I don't have a good answer. I really don't. But frequently wiping down if you're able to get cleaning supplies, because that's a whole nother issue. Everything is sold out. And I don't even know how you do the spacing to keep everyone at least 6 feet apart if you're in someone's home. Again, that communication between parent and caregiver, both with what they're doing and your expectations. And if they don't know, then as the parent, trying to research and find out some information that you can provide to them to help them out, because right now we're all in this together. So yes. If I find an article that says, you know what, you shouldn't do story time anymore in a circle, or you should do staggered, and this group, you have 3 kids over here working on story time and 3 kids over here working on arts and crafts, and sharing the information. Like, we all have to share the information, accurate information. And so I'm so glad that you're doing this seminar, because it is a challenge. And every day we find a new curveball like this. We've never seen anything like this before, because normally viruses affect the young and the old. So I think we were all kind of sighing or taking a breath of relief when we thought that the children were spared, but then we saw the syndrome in New York. And now it's like, okay, we have to ramp up, because again, in 3 or 4 months, kids are expected to possibly go back to school. I was reading the recommendations, and they're supposed to skip a row on the buses, because that again is going to get into those social determinants of health. Well, if I'm sending a child across town and they're doing this, how do I make sure they're safe on the bus? How do we keep the bus driver safe? Because in some of the districts, the bus drivers were taking lunches around, but then they had to stop doing that because the bus driver started coming down with COVID. I don't have good answers. And as a clinician, that is frustrating. But as a community servant, I'm willing to talk, and I'm willing to brainstorm with other people so that we can get them.
Thank you. And everything you mentioned, we've seen that and a whole lot more. We've even seen in, I believe it was Chicago, with a bus driver who died because he was exposed to it. I heard the other day that someone got COVID because they got it in their eyes.
So that is a new method of transmission that they're exploring. Initially, we thought that the red eyes that people were getting were because someone was sneezing or because it was part of the viral syndrome. A lot of times when you have different viruses, the eyes will be affected. But now, again, there is research that's actually a port of entry. So if you're thinking about a cloth mask, well, clearly your eyes are uncovered. So in a healthcare facility, we wear face shields. But I don't even know how you begin to protect the public. Do we have everyone wear shades? Does everyone wear glasses? I don't have good answers. So there are brilliant researchers that are working on finding those answers. And I find my role in this is to be able to, again, engage with different communities and spread the information.
Yes, and then going back for a minute to at-home daycare facilities, when you mention masks, many of these individuals, I don't think have masks for all the children. So that would mean each day that the child comes into your home, you would need a different mask. So you would need to be buying, a stock of these to supply.
If possible, buying a stock or talking to the parents and asking them if they can supply them. And that again gets back into that communication. And I think if we don't have the conversations, we never know where to even start. So if you have the communication, well, I can provide masks Monday, Wednesday, and Friday. Can you do masks Tuesday and Thursday? Or you know what, we'll do cloth mask, and please make sure you sterilize it every night before you send your child back. Those are other options too, but we have to open that line of communication.
So when I wear a mask, it's not protecting me, it's protecting you. If you wear a mask, it's not protecting you, it's protecting me.
So right, that's for the cloth mask and for the paper mask. It's not until you get into the N95 respirators that those begin to protect you. When you get into the N95, it's actually filtering particles out. Anything cloth, anything that you just bought because it was really cute, and I've seen some really cute cloth masks, but again, that's protecting you, not me.
At the grocery store, when I go shopping, there's a sign on the door that says, no mask, no entrance. So I go in there, I have my mask on, I have my gloves on. I go in the grocery store and what do I see? Even though the sign's on the door, people walking around with no mask. And that just really gets under my skin because I just don't understand it. And Dr. Russ, I've heard some people say, oh, this is a hoax. Why are you wearing a mask? Wearing a mask is not going to protect you. Wearing the mask, carbon monoxide, you're not going to be able to breathe. You're harming yourself. I just don't understand that mindset.
So there are a lot of things that people believe that are not consistent with reality. And that's the only way to put it. I don't have a scientific answer. Coronavirus is real. I think if you talk to anybody, they know somebody at this point that's been affected by it. Some people do complain about breathing. I can guarantee if you're in a cloth mask or a paper mask, you're not suffocating yourself. You're getting plenty of oxygen. I think the best example is to think about surgeons and surgical nurses that are in an OR all day with masks that don't pass out, that they continue to provide for their families. So masks are safe. It does take some getting used to. There's no doubt about that. You now have something on your face that you didn't have 3 months ago. But I think when you think about, oh, I'm protecting others, let me contribute, let me be a good citizen, and a citizen in terms of citizenship, nothing else, nothing political. I think hopefully that refocuses people. One thing that I want to say about gloves, and this is really important too, is to remember that when you're using gloves, if you're touching this surface and that surface, you're cross-contaminating. So if you're going into one store and you don't want to touch any of the carts, then that's one thing. But if you keep the same gloves on all day, that's actually counterproductive. Additionally, if it's a disposable glove, it really is meant to be used once. I know I've had people say, well, can I reuse them? Can I wash them? When you wash gloves, it compromises the integrity of the glove. So whatever you're trying to protect yourself from, you're not doing. And then if you have a wet or damp hand under a glove, then you're actually at risk for inflammation and dermatitis of the skin as well.
So how I have been using it myself is, let's say if I go to the grocery store and I'm there right now, I walk in there, I have my gloves on. If they have those wipes, I'll grab one and wipe down my cart. So once I leave that grocery store, I remove my gloves and I dispose of them. If I go anyplace else, I keep in my car, I have a box of gloves that I keep at my fingertips, so that way I have.
Absolutely.
But everyone doesn't have access to all those things. Some of them are hard to find. I've even gone on, I don't know if you're familiar with the website called Wish, W-I-S-H.
Mm-hmm.
I've used that a lot to get some things that I couldn't find locally. Some things you can find at the dollar store. Some things is just out of stock, just like toilet paper, for which I don't understand why that's a run on.
I have this theory that if you tell somebody there's a shortage of something or that there will be a shortage, they go and buy it and then they trigger said shortage. That's just my theory. Again, some things, people are people. Part of the reason why I love what I do is I get to talk to people and learn different perspectives on life. I mean, I will say this, because sanitizer, like you said, for a while there was a shortage of sanitizer. Soap and water still works. I think a lot of people fell in love with the magic of sanitizer, but soap and water is still effective. And we know we want to wash for 20 seconds. They have plenty of videos. You can sing the different songs to make sure you're washing long enough if you're not able to access sanitizer.
Yeah, you're right. Soap and water always works.
Just, you gotta, sometimes when that mind is worried, you have to be reminded of the basics.
Oh, definitely. Now, I know you're in an outpatient clinic, correct?
Mm-hmm.
So what are some of the things you have noticed or learned about COVID, perhaps, that you didn't know before?
So again, in January, we knew that there was a new strain of a virus. We were asking if people had recent travel exposures and if they had a fever. So I think the biggest thing about COVID now is knowing that, one, we have community transmission. So you never have to leave your city and you can still potentially be exposed. And that's where the importance of testing and contact tracers who trace where it spread to. That's the importance of that, is to know how much of COVID is actually in your community. And then also the list of symptoms. Again, 3 months ago, have you had a fever or a cough? Now we ask about diarrhea. We ask if you've had a loss of sense or smell. I think the best quote that I heard about this is, we're building the plane as we're flying it. We're learning about it as we're trying to fight it and defeat it. So the list of symptoms can be varied. If you have something, please reach out to your healthcare provider to talk to them about it. Everyone I know, we're up late at night reading, we're sharing different stories. Have you heard this? Have you seen this? So that we can all be on board to take care of patients in whatever capacity it can be. As outpatient, my goal is to keep people out of the hospital unless they absolutely need to be there. If you're having a heart attack or a stroke, you need to be at a hospital. And even specialists in the hospital have noticed our volume is down because people are, or they're presenting much, much later, 3 or 4 days after a stroke. So if you're having those symptoms, you still need to go be evaluated. But if it's something that we can take care of in a telemedicine visit, or if you can come into the clinic for one of those rotating weeks, by all means, let's get it taken care of so that you don't have to go to the ER. And I think if we look back a year ago, we knew that people were using the ER for primary care. So now with more accessibility, hopefully that has stopped, and that'll be a trend we're able to continue into the future, keeping emergency room for emergency care.
One thing that, well, there's several things that concern me, but one thing in particular is towards the fall, let's say when we get close to flu season. Now, flu season, they're saying that we may see more of COVID. I mean, it's still here, so I don't know when it's going to leave, but that combined, and then when they talk about having the flu vaccines, I mean, it's just so much to imagine that, to have the flu on top of COVID and trying to treat all that, what that's going to look like. Because here in Illinois, schools ended, for the rest of the year. Some may be resuming, maybe hopefully we will see in the fall. We really don't know.
Right. So you're absolutely right. We are concerned about a second wave, and the thought of flu and COVID is terrifying, because I think initially people were like, oh, this isn't any more serious than the flu. Well, people die every year from the flu. So it is more serious than the flu, but if in your mind it's not, the flu is still deadly in and of itself. So when you take those combined, again, that's another time where we're worried about overwhelming the system and being at capacity. I am a big proponent of the flu vaccine, unapologetically so, because I know what the flu vaccine is designed to do. If I can take a moment, the flu is designed to ensure that if you get the flu, you do not die from the flu. It's a best guess of what strains are going to be prevalent this year. So yes, sometimes people say, oh, I took the flu shot and I still got the flu. That is possible. I don't discount that science, but you took the flu shot and you didn't die from the flu. And then some people say, oh, I took the flu shot and I got the flu. And what really happened is you can't, it's not a live vaccine. So I can scientifically say you do not get the flu from the flu vaccine. What happened is you get the flu during cold and flu season, and you got a cold that you would have gotten anyway, but you associate it with the vaccine, because we're humans. We want to make sense of, I did this and then this happened. So we always say there's a difference between something occurring at the same time and something causing something else. Yeah. Having said that, by all means, in the fall, a flu shot is critical in protecting yourself from the flu and subsequently the effect of flu and COVID together. It's scary. I will say that. It's definitely scary. Right now, the question is, well, how do you give the flu vaccine to a lot of people without having a lot of people congregated at the same time? And so some of, again, those brilliant minds are coming up with these plans because we have challenges we've never had before. And I do believe that we'll rise to the challenge. I believe that if we work together, we can do it. And then in the middle of all this, we have an election, which I am as civically oriented as it gets. And I kind of forget that, oh my God, this is a presidential year. So we have a lot to work on and a lot to work together. But if we're open and we communicate, I do believe we can do it.
Yes, and getting back to the election, so a couple of things. That's very vital. We must have that election. We must. And I don't want to get political, but I will get political. We've got to have it. That must be done. It's scary to not have it. The other thing is the flu vaccine. My husband and I get a flu vaccine every year. I definitely have to get it done because I'm diabetic. So I cannot afford to get the flu.
No, I understand completely. I'm asthmatic. So the last thing I want is to be an asthmatic with the flu. I get it. I make sure my husband gets it. My son we go together, we get it. And then that's one thing checked off the list. And again, it's those same principles. When we get into flu season, you're still going to need to wash your hands. You're still going to want to make sure that you're not going to work if you're sick. And then we get into the jobs that have sick leave, jobs that don't have sick leave, all of the people that are now unemployed, and then employment tied to health insurance. And when you're unemployed, you no longer have health insurance. Like, where we have found ourselves as a country, if we don't start having those hard, serious conversations, I don't know what it's going to look like in 10 years.
I don't even know what it's going to look like in 3 years if we don't have these conversations and change the tide. I look globally to see what other countries are doing for their citizens. And it's shameful to say they're doing a better job for their people than we are. And many of them are, I don't know if all, but many of them I've even seen when it comes down to the $1,200 in the US that they were given. And some of these countries they've given, the larger ones that can afford to do so, may have been giving some of them like $5,000. They've been doing different things. You know, they're even testing more than we. That's just mind-boggling to me. That how is it we don't have enough to go around? Why is it more people can't get tested, and why is it not enough testing centers are in Black communities? And then I look at, Dr. Russ, what they're doing in the Native American communities. Their populations have exploded with COVID.
They are. I want to say that when they did a certain statistic and looked at, if you just isolate the numbers, Navajo Nation jumped higher than most states when they looked at those numbers. You're right. Communities are being decimated and destroyed by this. And I want to say by last count, it was approximately 19,000 African Americans that had actually died from COVID. And so you look at the total number, okay, last I looked, we were at 96,000. So just doing easy math, about 1 in 5 of Americans that have died from COVID are African American. Again, this is another statistic that we're overrepresented in, because we're only 13% of the community or of the population, but yet we're 20% of the COVID deaths nationwide. These are why we need to have these conversations. Part of it was because in the beginning we weren't testing. Because I remember 3 months ago on Facebook, oh, we don't have to worry, we don't get the Rona. I remember those posts. I actually think one of the first celebrities, it was a basketball player that got it, and then Idris Elba. Those were two of the first people of the African diaspora that had COVID. And part of that was introduced in the beginning when the surveys were, have you been to China in the last 14 days? While some people do travel, you know, most of my patients had not been to China in the last 14, actually none of my patients had been to China in the last 14 days, but most people hadn't been. So they automatically were excluded from further testing. So that's part of why the numbers were so skewed in the beginning. And then part of it is we do have a lot of underlying health issues for a variety of reasons. A lot of those go back to those determinants of health. If you don't have a grocery store in your neighborhood, if it's not safe to walk, how can you get proper nutrition and exercise? So that we were sicker to begin with. And then we weren't tested, so we came in later. And then it was, oh, this is going to hit, and this is going to hit hard. And, you know, the numbers have played out to that effect.
Yeah, it's just, I tell you, very, very perilous times that we are in. And as a woman of faith, I know we need God more than anything to get us through this, because this, I remember, I think it was it 1819 when they had a pandemic. I'm trying to think, 1819.
1918. It was the Spanish flu, which actually started in America. So I don't think history will ever correct calling it that. So part of that was, again, that was the end of World War I, right? So you had soldiers going all around the world and spreading it. And that goes back to that thought of the second wave. The first round, 3 to 5 million people died. That fall, when the second wave hit, it was 18 to 20 million people that died. I think when you study those, and again, we've had pandemics throughout history. Like, you can look. I'm going to call it the bubonic plague. I'm not going to call it the Black Plague. The bubonic plague in Europe, 1/3 of their population. I would like to think we've come farther from there, and we know what it takes. It takes a lot of self-sacrifice. It takes a lot of behavior modification. It's hard not to go out and be able to do things you once enjoyed. I don't take it lightly. It's hard when you have to go to work. It's hard when you don't have someone to watch. It's hard. But I do think those times when we can take measures and maybe make a sacrifice, skip a birthday party here, you know, those are when we are able to step in. Like I tell my patients, there are a lot of things we can't control. I don't know what's in the water I drink. I like to think it's okay, but I don't know. You know, I don't. But the things that I can control, I'm going to take every advantage. I already told you, I like to have my voice heard. I want to make sure that if I can control it, I'm going to.
Yeah. Now, Ebola, was that a pandemic as well?
So we were worried that it was going to be. It actually was an epidemic. And the difference is an epidemic is when you have a huge outgrowth in a localized population. And so that was 2014. And then a pandemic is when it's a huge outbreak globally. And
Okay.
it didn't spread. They were afraid that it was. And I know we remember there were a couple of Americans that came and they got treated. And then there was an African gentleman that came and he didn't make it. And that was a whole discussion in and of itself. But that's the difference.
Okay. Wow. This has been really eye-opening. I tell you, I don't know what else to say. I mean, just thinking about everything that we're faced with, that we are dealing with, getting beyond this, many people didn't expect this, and many people are still opening up different states. People are go back to work. I'm one of those that if I'm at the job and I see you just openly coughing, I tell you right now, I just tell you, just get away from me. You know what?
I don't know what the next few months hold. I do know, again, as a person of faith, to pray. I know to make sure that I have my affairs in order. And again, the things that I can control, wearing my mask when I go outside, washing my hands, and staying home when I can, that's what I'm going to do. That's what my household is going to do. I do believe that we're a resilient people. I do believe we can make it to the other side, but I believe we have to communicate, and I believe we have to be open to change.
Thank you. I thank you for your time today. Is there anything else you would like to share with the community?
I just want to say, don't give up hope. We can do this, y'all. We can do this. Please stay safe. And again, it was a privilege to be able to speak with you. And if I can give assistance in the future, please just reach out.